AVM is, the full name is arterial-venous malformation. Essentially that there are abnormal connections between the arteries and the veins of the brain.
So normally the arteries carry blood up to the brain and then end up in very, very tiny capillaries. And that's actually the place where the blood is feeding the brain with nutrients and oxygen.
In an arteriovenous malformation, those capillaries don't form right, and so the artery is connected to the vein either directly or through some relatively small abnormal blood vessels. And the problem with that is that those small abnormal blood vessels can be weak.
And so they could burst anytime. And when it bleeds, it creates pretty large pressure that results in very bad headaches, nausea, vomiting, or sometimes the patients just become unconscious.
And depending on which part of the brain is injured, it can cause weakness on one side of the body. It can cause problems with language or loss of vision. In other cases, people find they have an AVM because they have an imaging study for some other reason. Say they hit their head and they get a CT or an MRI and they see an AVM. In those cases, they often don't cause any symptoms. So it's a real surprise when people find out that they have an AVM because there are no signs that they've had that before.